Hello, I'm Dr. Justin Carlin, board-certified oculofacial plastic surgeon, and I'd like to speak to you today about aesthetic eyelid surgery, particularly the risks, benefits, alternatives, and indications, so that you can give informed consent. Why do we perform aesthetic eyelid surgery? Well, there are changes that happen with age, such as laxity of the skin, slackening of the muscles, and bulging of the normal fat pads that cushion the eye. This, coupled with volume loss of the midface and brow, or descent of the brow, can result in an aged appearance. For upper eyelid surgery, we'll contour the muscle, fat, and skin of the upper lid to give it a more youthful appearance, and we'll try to hide the incision as best as we can in the natural eyelid crease. For lower eyelid surgery, I typically combine approaches where I will sculpt the lower eyelid fat from a hidden incision. I'll address muscle laxity using that hidden incision, and then I will address any skin changes from the outside, either with a skin pinch surgery, which will involve a relatively hidden incision under the lashes, or a CO2 laser resurfacing of the skin. I will treat facial volume loss with microfat grafting to the midface and orbital rim hollow. The most common and least serious risks include bruising, swelling, and pain. Patients do experience variable levels of this, and they typically resolve within several weeks after surgery. Less common but more serious include visible scarring, asymmetry. These can be addressed with further procedures. That's another risk, is a need for further procedures. Fortunately, severe complications are very rare, including double vision, loss of vision, stroke, and loss of life. Even though I often quote these catastrophic complications at about 1 in 10,000 for patients, it's important to know that these things are possible with every procedure. There are alternatives to surgery that you should know. These include facial fillers, Botox injection, and skin treatments. Successful outcomes depend on good general health, reading preoperative and postoperative instructions carefully, strict adherence to aftercare instructions, and realistic expectations with what can be achieved with surgery. Please complete all preoperative tests and follow all postoperative instructions. Make sure you have an escort on the day of surgery, and stop all medications or supplements that we've asked you to cease before surgery. If you have any questions or comments, our contact information is listed below. Please reach out and one of our office staff members will be sure to get back to you. Thank you for taking the time to understand the procedure and the risks associated. I look forward to taking care of you.